This morning I want to show you a patient that's a follow-up of a year and a half after correcting metatarsalgia by osteotomy of the second, third, and fourth metatarsals utilizing minimally invasive surgery. And also how we assess this with the Peacock press and how that helps us with metatarsalgia. Now when we're looking at a patient, this is a year and a half later. You look at her foot now. When she presented with us, she had a very bad IPK on the third metatarsal. And we performed metatarsal osteotomy of the second, third, and fourth metatarsals. Now, when we're doing metatarsalgia, we look at something I call ELF press. Look at whether or not the patient has equinus, where the location of the pain is at, the foot type, and also the Peacock press. So those are the things that we look at. If you look at her foot, you can see if we test her for equinus with her knee extended, you can see that she doesn't have equinus. So we don't have to address equinus with this patient. With her location, the pain when she came was in the third metatarsal. And the reason that's important is because we use the Levantine formula. If we're going to address the metatarsals, if the patient has a third metatarsal issue, we also do osteotomy of the second, third, and fourth to prevent transfer pain. And then we look at foot type. If you look at her foot type, we load her foot in root neutral position, loading the forefoot. We assess the rear foot. Her rear foot, when we try to evert it, will not go past neutral or vertical line. So she has a rigid rear foot. She has a very flexible forefoot because we look at the forefoot by looking at the first met. You can see her first metatarsal goes above her first ray, and it goes below her fifth ray. So we're looking at this bisection of the fifth ray. Above the fifth ray, below the fifth ray. So her foot type, she has a rigid rear foot and a flexible forefoot. Now one of the interesting things, when we were doing her surgery, we used the Peacock press as well and looked at her metatarsals, which shows the vertical depth of the metatarsals. So during surgery we can get the patient in neutral position. We press up on the third and fourth and second toes and press up, and we can look at blanching under here. And this can also be addressed and looked at using an ultrasound. So during the surgery we can take our ultrasound and actually assess the depth of our metatarsals with the ultrasound. Now what I'm going to show you today, this is a year and a half later, I'm going to show you the difference in the depth of her metatarsals now as compared to preoperatively. So today we're going to kind of look at this and show you her depth of her metatarsals now as opposed to the way it was before surgery. So we're going to get that view right now and show you that. We've got her in neutral position. We'll load her forefoot, press up on the toes, and this is our view right here. So you can see our view at this point right here. And we see that our first metatarsal has a depth of 0.85, second at 0.77, and third at 0.69. So now what's even more important is whether or not the patient's pain goes away. And this is important. When we saw this patient, when she came to us, she was having trouble at work because she's on her feet a lot. And now we're a year and a half later, and the x-rays look great, everything's consolidated. And we're going to ask her how she feels real quick about this. So I know you were having you have some issues with this foot here, and we'll just ask you what your experience was with this. And sure. Now that this is a year and a half later, you're at work every day. How much pain are you having now?
None. I feel like I got a brand new foot.
Great. So that's directly from the patient. So you don't need to neglect metatarsalgia. There are different tools you can use to treat this, especially in a lot of minimally invasive procedures. So here we got a patient today just said she has a new foot, and we treated a static metatarsalgia issue with her, utilizing minimally invasive surgery, as well as using my mnemonic, the ELF press, which is whether or not a patient has equinus, location, foot typing, and then the Peacock press.